brain stroke is nothing but a dysfunction of a part of a brain due to sudden blockage in the flow of blood to the brain, or if there is any leakage in that part of the brain. So because of these damages, either due to blockage or a leakage of blood into the brain, there is dysfunction of that part, and that leads to stroke or paralytic attack. If a patient presents to us either in OPD department or in the emergency department, basically there is an acronym called BFAST, BEFAST. The B stands for balance, E for eye abnormalities, F for facial drooping, A for arm weakness, S for slurring of speech, and the letter T stands for time to call the emergency. So this can happen in any brain disorder, meaning that a weakness on the one side of the body or any facial drooping can happen due to anything. But if it is due to a stroke, whether it is due to a stroke or not, is usually suspected when there is an explosive onset of this illness. The sudden nature of the disease is the most critical feature in diagnosing a stroke. So this comes suddenly. All these abnormalities, they come all of a sudden, like out of blue, within seconds. If they come like over weeks or months, it can be due to any other cause, a tumor, an infection, anything can cause these symptoms. But this explosive nature is what defines stroke. The causes may be either due to blockage. So the blockage can be either from, suppose a thrombus. A thrombus is like a clot. A clot can be thrown up from the heart, and that clot can go through the blood vessels of the brain, and they can suddenly block it, and that stops the blood flow to the brain. That is called as cardiac stroke. Or there can be due to cholesterol deposition in the vessels or the arteries supplying the brain part. So if the cholesterol deposition is too much, that can cause the blockage to the blood flow to the brain. Or there can be a disease in the carotids. Carotid is one of the major arteries supplying the brain. And if there is a narrowing of the carotid, we call it as carotid stenosis. If that is there, if it gets progressively narrowed, that can cause a stroke. Or so if there is a bleeding in the brain, that is due to a different set of causes. That is usually due to a hypertension. If there is a hypertension, the blood vessels are not able to accommodate this excess pressure, and they just burst open, and that leads to a hemorrhagic stroke. Or there can be a aneurysm inside the brain. Aneurysm is like nothing but a balloon-like outpouching of the brain blood vessel. If that is there, and they suddenly get burst, and that leads to leakage of the blood surrounding the brain part. All these are termed as hemorrhagic strokes. Stroke is more common in elderly, but nowadays we are seeing young stroke due to changes in lifestyle, and because of the demands of the society. We are doing night shifts and all these things. Now we are seeing a stroke in the young population, around like less than 40 and all these things. But usually it is a disease of the elderly, but it can affect even in children or young adults less than 20 years of age. But in those subset of patient, it is usually due to a cardiac illness like congenital cardiac defect, or in any blood abnormalities like sickle cell anemia or something like that. So it differs in different age group. But the classical stroke which we see is common in the elderly. That is where the cholesterol deposition happens, and all the comorbidities like hypertension, diabetes, they start to appear, and then they develop stroke. The most important thing that you can do is call the emergency services and take the patient to a stroke ready hospital, or a hospital which is a comprehensive stroke center. That is what we can do. Like in cardiac disease, the heart patients, we give this blood thinners, aspirin, clopidogrel, atorvastatin. Patient take this without consulting a doctor before reaching the hospital. The heart patients can do that. Neuro patient, stroke patient cannot afford that, because stroke also includes bleeding in the brain. So we have to rule that out first before doing anything. So better take the patient to the hospital. Make sure that the patient doesn't choke on himself, meaning protect his airway. Don't give anything in by his mouth. Don't put water or anything. Just take him to the nearest hospital. They will do the neuroimaging, CT scan, MRI scan, then they'll take it from there. Less than 6 hours is always better, but if not, at least less than 24 hours is better. But even if it is crossed 24 hours, don't keep the patient at home. Try to keep bring the patient as early as possible to the hospital. Even sometimes beyond 24 hours, we can go beyond guidelines if necessary conditions permit. We can even do endovascular emergency treatment even at those group of patients, but under some strict criteria. If it is due to blockage of vessel, which is the most common cause of stroke, 80% of stroke is due to blockage of vessel. If it is due to blockage of vessel, if the patient presence was within 4.5 hours, we'll give an emergency drug called clot busting agents. They are thrombolytic agents which they drill through the clot and they restore the blood flow. And if the patient presence was beyond 4.5 hours and less than 24 hours, there is an advanced new treatment called endovascular thrombectomy, mechanical thrombectomy. Basically, it's like a fishing net. We go in platinum kind of a mesh. We go in, deploy the mesh in the thrombus. So the mesh catches the thrombus, like how a fishing net catches a fish. The platinum net catches the thrombus and then we remove the clot and this restores the blood flow. This is for the ischemic stroke where there is a blood blockage. For the hemorrhagic stroke, if the bleeding is small, we control the BP and we hope that the blood gets absorbed. If the bleeding is more, it's very expansive, then we consult neurosurgery. But if the bleeding is due to an aneurysm, which is like an outpouching of the artery, we go in and coil the aneurysm. Coiling is a process where we deposit platinum wires inside the sac of the aneurysm. And this prevents further leakage of blood inside the brain. Stroke patients will be under tremendous emotional stress and they'll be depressed most of the times. So they would need counseling, physiotherapy for the weakness that which they develop, and speech therapy for their speech problem. They might be having some kind of a speech problem most of the times. And occupational therapy, how to rehabilitate this patient with the nature of their work. Basically, we try to rehabilitate the patient depending upon the nature of his work, previous work before the stroke event. Prevention of stroke depends upon the control of risk factors. The risk factor, like I told you, diabetes, hypertension, and cut down smoking and alcohol, and keep the blood pressure much less to in the normal range. Keep the sugars in the normal range. Keep the cholesterol in the normal range, and proper sleep hygiene. And most patients that have undiagnosed obstructive sleep apnea. They have some sleep disorders. They snore throughout the night, and even then that can interfere with the normal BP regulation in the night hours. So control this obesity. So these things are basically control of this preventable factors. And if the patient has some cardiac illness, like for example an abnormal rhythm of the heart, so controlling the rhythm and taking some blood thinners, which can prevent the formation of a future clot. So these things can be done.